Hey everyone, it's your family doctor. Thanks for tuning in. Have you ever felt like you're doing everything right on paper, eating okay, taking your meds, but you just don't feel healthy, like your body is running on empty, especially your heart and blood vessels? I've been practicing for over a decade, and let me tell you, I have never once believed that you need some rare, expensive, exotic ingredient to get better. That's just not how medicine works. When I teach my residents, I don't start with fancy new drugs. I start with the basics. We look at the patterns. We look at the patient and we match the treatment to the person, not just the disease. So many of my patients come to me after spending a fortune on imported supplements or the latest brand name pills. They take them and sure, the symptom goes away. But do you actually get healthier? Honestly, most of the time, you're just putting a band-aid on a bullet hole. You're masking the discomfort, but the root cause, the real issue is still there, hiding, it's biding its time, waiting until you're older, more run down until your body can't compensate anymore, and then it hits you all at once. Let me give you a couple of real examples. After a talk I gave a while back, an older woman came up to me and asked, Doc, I've been on blood pressure pills for 10 years. Should I stop? I asked her, after 10 years, is your blood pressure good enough that you don't need them anymore? She said, the minute I stop, it shoots right back up. I told her, then you're not treating the problem. The medication is managing you, not the other way around. You think you're controlling the numbers, but the drug is running the show. And as your body gets more fatigued, that dose is only going to go up. Another time, a younger guy came up to me after a little embarrassed. He said his dad had a stroke and was now on a whole laundry list of medications. He could barely walk. He asked me if there was anything simple, low cost, low burden that could help. I said, go to your local herb shop and pick up two things: salvia root, what we call Danshen, and dried hawthorn berry. Steep them in hot water. It's inexpensive and it works. He looked at me like I had three heads. He couldn't believe it was that simple. I just said, don't trust me yet. Just take it home, have your dad drink it for a month and see how you feel. Well, 2 weeks later, his dad had more energy and was walking steadier. At his 3 month checkup, his own doctor asked, what changed? You look like a different person. And the son told me later, laughing, he's on the same meds. He just added that tea you recommended. This is not magic. I've seen this story play out hundreds of times. Now, I know a lot of you might think these are just old-fashioned herbs, but let me tell you why they work. Salvia or Danshen is all about getting things moving. It helps blood that's stuck, that's stagnated, start flowing again. It's like a traffic cop for your circulation. Hawthorn berry, on the other hand, is a cleaner. It breaks down the greasy, fatty buildup that can clog your system. When you put them together, they're the perfect team. One loosens the blockage, the other sweeps it away. It's probably the most affordable, most effective way to take care of your blood vessels. Let me be clear, I'm not telling you to throw away your prescription meds. I'm a doctor, not a guru, but I want you to understand a fundamental truth. Your body lives through your blood. When blood flows freely, you're healthy. When it doesn't, problems start. A lot of people ask me, why are your suggestions always so simple? Why don't you add ginseng or expensive imported ingredients? My answer is always because we don't need them. The ancient texts, the ones that form the foundation of our practice, they already mapped out how the human body works, where the energy goes, what time of day your system is weakest or strongest. Why would we ignore thousands of years of that wisdom just to rely on something synthetic and new? The real medicine, in my view, comes from the earth. It's grown, it's dried, it's prepared, not just synthesized in a lab. When I practice, I don't just look at your chart. I don't just stare at your lab numbers. I look at your tongue. I ask about your sleep. I take your pulse. Your body is giving you clues all the time. Are you low on energy? Is your blood sluggish? Are you depleted? Your body is literally telling you, but you have to be willing to listen. Some of my colleagues in mainstream medicine will say, well, this isn't scientific. And I ask them, you can't see the wind, but it's there. You can't see energy, what we call chi, but you can see its effects. When it's gone, the patient is gone. If you don't understand that, it's hard to understand what's really going on. I always tell my students the best doctor is the one who makes themselves unnecessary. If I teach you how to eat properly, how to sleep well, how to move your body, and how to manage your stress, you won't need to rely on me or anyone else. But if I just keep you dependent on a prescription, I haven't solved your problem. I've just created a client. That's why I love the salvia and hawthorn combination. It's not rare, it's not a miracle, and it's not hard to find. Anyone can use it, anyone can understand it, and anyone can afford it. That's real medicine, practical, effective, and down to earth. So, why are we seeing so many people sick, especially with heart problems, at such a young age? Why are people in their 30s having strokes? It's not our genes, it's our lifestyle. We eat at all hours. We love iced drinks and cold smoothies. We're eating greasy late night takeout while sitting in an air conditioned room. We grab a quick lunch, eat it at our desk, and our body is literally screaming for help. All that heavy, cold, greasy food, it damages the stomach, makes the system sluggish, and slows down your internal energy. And when that happens, the blood can't move. And when blood can't move, it starts to pool and get sticky. That's the beginning of trouble. So many people are tired all the time. They can't get up in the morning. They can't fall asleep at night. And they're chugging coffee or energy drinks just to get through the day. Your body isn't a machine. You can't run it on empty. Moving is good, but rest is essential. If you push too hard and sleep too little, you deplete your engine, you exhaust your heart. Your vessels lose their nourishment. They get dry, stiff, and brittle. And let's talk about stress. Anxiety is through the roof these days. Money, kids, work, the news, it's nonstop. Every emotion affects you physically. Anger, worry, sadness, fear, even too much excitement. They all take a toll. When you run through the whole cycle every single day, your vital organs are stressed constantly. How do you expect your blood to stay clean from a traditional standpoint? Heart disease doesn't happen overnight. It's the result of years of stagnation. And where does that stagnation come from? From the junk we eat, the lack of movement. The emotions we bottle up and the energy we don't replenish. Think of your blood vessels like a river. If you dump trash in it, if there's no rain, if the water doesn't move, the river gets muddy and backs up. Eventually, it stops flowing. Western medicine calls it hypertension. High cholesterol, high triglycerides, they give you a pill for each, and the numbers, they look better. But how do you feel worse? Legs feel weak, you're tired, you're bleeding from your gums, you're not controlling the disease. The disease is controlling you. I'm not here to bash modern medicine. I prescribe it too when needed, but you need to understand your enemy is not a number on a machine. Your enemy is the root cause of that number. You want to clear the sludge, restore your energy, and rebuild your vessel health. If you just chase numbers, you're never going to win. Traditional medicine treats the person, not just the disease. It doesn't say this is a heart problem, this is a vascular problem, this is a diabetes problem. It looks at you as a whole. Is your system too cold, too deficient, too blocked? Only by looking at the big picture can you start to fix the root. Aging is natural, but how fast your blood vessels age depends on how you live. Eat clean, stay calm, get enough sleep, move your body, and you'll age gracefully. If you live on junk, stay up all night, and hold on to anger, your blood vessels will harden faster. That's just the truth. People hear hardening of the arteries and they think it's like a pipe rusting. Your arteries are alive, they're dynamic, they respond to what you do. If your energy is strong, your blood flows and your vessels are elastic. If you're low on energy, they get brittle like dry bamboo and they crack easily. I remember a patient, not even 50, who was told he had severe hardening and needed surgery. I looked at his tongue, dark, covered in spots. His pulse was rough, uneven. I told him this is not a vessel problem. It's a flow problem. If you get the flow back, the elasticity comes back. The machines see the cholesterol and the calcium deposits. I look at the blood itself. Is it warm? Is it moving? If it's cold and stuck, it's like standing water. It gets toxic, and that's what hardens the vessels. Many of my patients think they're missing a pill. What they're actually missing is energy, movement, and warm, nourishing food. I always say vascular aging starts with a lack of warmth. When you're young, you're active, your blood runs hot and fast. As you age, it slows down. So when elderly patients have cold hands and feet and can't walk well, it's often not just age, it's a lack of vitality. If you don't restore that warmth, you can take all the iron and vitamins you want and it won't get delivered. It just sits there. And when it sits, it turns into stagnant, toxic blood. That's what causes strokes, heart attacks, and kidney failure. All those healthy foods you eat. If your blood isn't moving, they can't get to your cells. They just become more waste. You go to your annual checkup, the labs look fine for now. You say, I feel fine. And I say, you feel fine doesn't mean there's no problem. Vessel damage doesn't wait for you to feel it. It's happening long before you ever feel any pain. When you see calcium and plaque on your report, doctors call it aging. But why is the plaque there in the first place? Because your body has inflammation. It has cold and dampness. It has blockages. The cholesterol is just the body's way of patching cracks. It's trying to protect you. It's not betraying you. It's trying to save you. One of our core concepts is this: if there's free flow, there's no pain. If there's pain, there's no free flow. You don't have to wait for the pain to hit. You want to clear the blockage before it's too late. And the way to do that is to build your energy, move your blood, and restore your warmth. That's not something you get from a single injection or a surgery. Surgery can open a vessel, but it doesn't fix the underlying issue. That's why I see so many patients who had stents put in and 2 years later, they're blocked again because they didn't address the root. So how do we actually do this? Let's talk about salvia root again. It grows in the dirt. It looks boring. It's not sweet. It doesn't smell like much. But it's been my go-to herb for decades for anything related to stagnation. If blood isn't moving, it moves it. If the heart is struggling, it helps open the channels. If the head isn't getting enough flow, it helps the blood go up. I had a patient who had chest tightness and got short of breath just walking. The hospital said mild angina. I told him, don't rush to get a stent. Try this for 3 months. He was skeptical, to say the least. But after a month, he told me, I feel lighter, not because the herb is magic, but because it cleared the gunk that was holding him back. Your body wants to heal. It just can't when it's full of sludge. The salvia clears out the old dead blood so new, fresh blood can come in. Some people worry it's too cooling, but it's actually considered mild. It's cool, but not harsh. It's designed to clear out stagnant heat and toxins. Now, if you're someone who is always cold, you might need to pair it with something warmer, but for general congestion, it's fantastic. And hawthorn berry, you've probably seen it at the grocery store, maybe in jam or in a dessert. You might think it's just for digestion, but it's much more than that. It's a premier remedy for breaking down fat, clearing out excess, and moving stuck blood. If you eat heavy processed food, it helps you clean it out. If your cholesterol is high, it helps break down the junk. I've used it for patients who have been on statins for years and their livers were getting sluggish. Their cholesterol was still high. I'd say go to the herb shop, get the dried hawthorn berries, and make a tea. Twice a day, then go get your labs rechecked. A month later, many of them were shocked. It's not that I'm a genius, it's that the plant works together. Salvia and hawthorn are a perfect pair. One moves the blood, the other helps clear the gunk. One focuses on the heart, the other on digestion. It's like a cleaning crew. One loosens the dirt and the other hauls it away. And the best part, they're affordable, they last a while, and they're easy to get. Now, you're probably asking, Doc, what's the right way to use them? I'm about to get into that, but you need to understand using herbs without knowing your body is risky. If you've got chest tightness, high cholesterol, a dark tongue with spots, and you feel heavy and tired, that's the classic profile for this combo. But if you're always cold, your face is pale, and you get winded going up the stairs, you might need to add some warming herbs to balance it out. And let me be very clear. Am I saying these replace your prescriptions? Absolutely not. Never, ever stop your medication without talking to your doctor. What I'm saying is this can support you. You add this to your routine. You observe how you feel. And if your numbers improve, then you and your doctor can discuss adjusting your dose. I don't sell anything. I don't do gimmicks. Everything I suggest is something you can do on your own. Go to your local herb store, get a bag of dried salvia and hawthorn, and make a tea. It costs very little. Drink it for 3 months. Will it cure a catastrophic disease overnight? But you will feel your blood moving. You will feel lighter. The biggest danger isn't not having enough meds. It's being so scared by the prognosis that you lose all hope. When your doctor says you'll be on this for life, it can be paralyzing, but your body has incredible healing power. You just have to stop hurting it and give it the tools it needs. These herbs aren't magic. They're like a ladder. They help you climb your way back to health. Let me tell you about a real patient. She was in her early 30s, worked at a tech company. Her friend brought her in. On paper, she was young and vibrant, but the minute I saw her, I could tell she was running on fumes, pale, cold hands, speaking quietly, barely any energy. She told me she had been having chest tightness. In a meeting at work, she suddenly couldn't catch her breath. She almost passed out. Her colleagues called an ambulance. The hospital said mild angina, some irregular heartbeats. Gave her a prescription for a beta blocker and a tranquilizer. She asked me, do I have a heart condition? Now, when I asked about her lifestyle, the story wrote itself. She worked late, stayed up until 2 or 3 in the morning. She skipped breakfast. She had a cold sandwich for lunch. She had food delivered for dinner. And she lived on iced coffee. She told me, Doc, I don't even drink warm water. It's all ice. It feels more refreshing. Her pulse was weak and rough. Her tongue was pale with a few dark spots. I told her, you don't have heart disease. You have extreme exhaustion. Your energy is depleted. Your blood isn't moving and you're on the fast track to trouble. You're in your early 30s now. But if you keep this up, In 5 years, we won't be talking about prevention. We'll be talking about stents. She was scared and she was honest. She didn't want to live on medications, which is why she came to me. So I told her, start with the salvia and hawthorn tea, and I don't want the sweetened, sugary kind you find at the store. I want the dried, medicinal kind. 6 grams of salvia, 10 grams of hawthorn. Steep it in hot water. Drink it twice a day after meals. Not on an empty stomach, but I also told her you can't just drink tea and keep living the same way. First, no more ice drinks. Second, you have to be in bed by 11 p.m., not midnight. 11. Third, you need warm food, soups, stews, warm meals, no cold salads for lunch. Give your system the warmth it's been missing. She did everything I asked. 2 weeks later, she came back and she looked like a different person. She said she was sleeping deeper. She wasn't exhausted when she woke up. And the chest tightness was almost completely gone. A month later, she went back for a follow-up EKG, and the doctor was amazed. He couldn't believe the improvement, she told me. I used to think traditional medicine was slow, but this feels real. I feel my body coming back. I told her it's not the medicine, it's your body. You just didn't give it a chance before. Now she's off the heart meds. She still drinks her tea every day, like a ritual if she misses it for a couple of days. She feels the chest tightness coming back, so she keeps up with it. Here's the thing, when people in their 30s crash, it's often worse because they don't see it coming, they ignore the signs, they push through, and then it hits like a freight train. It's not heart disease, it's a system-wide breakdown, and it's reversible. You don't have to wait to get sick. You can start now. You don't need expensive retreats or exotic supplements. You just need 5 minutes a day, a warm cup of tea, and the commitment to take care of yourself. So let's get into the specifics. How do you prepare it? How much? When? The simplest way is a tea. Go to a reputable herb store, get the dried salvia root. It should be red, dry, and fragrant, and get the dried hawthorn berries. Not the snacks, not the sugar-coated ones. The real thing takes 6 grams of salvia and 10 grams of hawthorn. Use about 16 to 20 ounces of hot water, bring it to a boil, then let it simmer for about 5 minutes, turn the heat off and let it steep for another 10 minutes. Drink it twice a day, once after breakfast, once in the afternoon around 3 p.m. This is your baseline daily maintenance dose. Some people like to add it to soups or stews. That works too. You can add it to a bone broth, a chicken soup, or even congee. If you're taking care of an older parent who hates the taste of medicine, this is a great way to sneak in the benefits. It will help with digestion, circulation, and help break down excess fat. But let me be absolutely straight with you. These are not party pills. You can't go out for a massive, greasy meal and expect this tea to undo all the damage in one night. That's not how any of this works, and it's not for everyone. If you're pregnant, do not drink this. The salvia can affect circulation in a way that isn't safe for pregnancy. If you're trying to get pregnant or you're nursing, skip it. Women should also avoid it during their menstrual cycle unless they have a very specific type of painful, stagnant flow, and even then, they should use it under guidance. If you're the kind of person who is always cold, pale face, weak voice, frequent diarrhea, no appetite, this might not be the right thing for you alone. These herbs are on the cooler side, so if you're a cold person, they might make you colder. You'd need to add warming herbs like ginger or cinnamon to balance them out. And if you have low blood pressure, be careful. Salvia lowers blood pressure. If yours is already low, you could end up feeling faint or dizzy. You also shouldn't take this forever. I've had patients say, I've been drinking it for a year and I'm exhausted. I ask, is your tongue pale and your digestion off? And they say, yes, they over-scrubbed. You don't sweep the floor forever. Once the dirt is gone, you stop. You need to rest and build your strength back up. You can think of it in phases. Phase 1, drink it daily for 3 to 4 weeks. See how you feel. Phase 2, scale back to 3 times a week. See if you can maintain. Phase 3, add in more supportive foods and herbs to help your body rebuild. If you're not sure about your constitution, start small. Pay attention to your body. If you feel bloated, dizzy, or get diarrhea, stop. That's a sign it doesn't work for you, and you should talk to a professional. See, even with just 2 ingredients, there's a lot to consider. It's not because I love talking. It's because I see too many people using things incorrectly and then saying it doesn't work. It does work, but you have to use it right. All right, that's all for today. Remember, health isn't built in a day, and it's not built in a hospital. It's built in the small daily choices you make. Can you give yourself 5 minutes to make a warm cup of tea? Your body will thank you. If you're dealing with any health concerns, please schedule a visit with your primary care doctor. I'm here to help you understand the science, not replace professional medical advice. This is for educational purposes only. Always consult your own doctor before making changes. Drop a comment if you're trying this. Let me know how it goes, and I'll see you in the next one. Take care. Bye for now.